Your healthcare provider has ordered a medication that will be administered using a CADD Solis pump. This instructional video will help you administer your medication effectively, comfortably, and safely. To get started, remove the medication from the refrigerator at the time specified on your medication label. Never speed the warming process by heating or microwaving the medication. Select a clean work area. Once established, clean your hands thoroughly using antibacterial soap and warm water. If no soap and water is available, use an alcohol-based hand sanitizer. Follow by drying your hands with a clean towel. Gather your supplies and prepare your SASH mat as instructed. CADD Solis pump, medication bag, IV tubing, flush syringes, alcohol wipes, and if necessary, sharps container and/or trash container. Inspect the medication bag, check the label, and verify. Correct name of patient and medication, volume, amount of medication, date of medication, amount of time needed to remove medication from the refrigerator to warm to room temperature. Next, prepare your flush syringes if you have been instructed to flush in between medication bags. Prior to using syringes, push firmly on the thumb press with the tip cap still on, just until you feel the plunger move. Expel air and excess solution by twisting off the tip cap and pushing the plunger forward. Push out extra solution to the amount instructed by your nurse. Finally, replace the syringe cap, being careful not to touch the tip of the syringe with your hand. If you touch it, you will need to start over with a clean syringe. Set aside the syringes until you are ready to use them. Repeat this step for all flush syringes needed for dose. You are now ready to prepare your IV medication. Remove the IV tubing from its package, then remove the blue clip from the bottom of the cassette. Remove the tab from the medication bag, then remove the cover from the spike of the tubing, being careful not to touch the end. Lastly, spike the bag by pushing and twisting the end of the tubing into the bag port. Make sure the spike reaches the medication and does not puncture the bag. Next, change the batteries as directed. If using a rechargeable battery pack, follow the instructions provided by your nurse. Turn the knob counterclockwise to open the door. Remove the used batteries and discard as instructed. Then, insert the new batteries matching the positive and negative markings on the batteries with the corresponding markings on the pump. Insert one battery at a time. Close the battery door by turning the knob clockwise to lock. Let the pump power up. You will hear 6 beeps. This process can take up to a minute. You are now ready to connect the new tubing to the pump. With the pump powered on, insert the new cassette hooks into the pump's hinge pins. Place the pump on a firm surface and push down on top of the pump. Finally, press up on the latch to lock the new cassette to the pump. Ensure the latch is flush with the side of the pump. You are now ready to prime your IV tubing. When priming, make sure the tubing is not connected to the patient. Primed tubing will appear on the screen. Select Yes. Confirm the tubing is disconnected from your IV catheter. Open the clamps and select Prime. Continue priming by selecting Yes when prompted until fluid drips from the end of the tubing. You can stop priming at any time by selecting Stop Priming. Reset reservoir volume will then appear on the screen. Select Yes. Lastly, after the pump resets the volume, Ready to Begin will appear on the screen. You are now ready to flush your IV line with saline. Scrub the needleless connector on your IV catheter with an alcohol wipe for at least 15 seconds and allow to air dry. If order indicates a different scrub product, please follow physician orders for your line. Once clean, do not allow the needleless connector to touch anything. Remove the protective cap from the saline flush syringe. Attach the saline flush syringe to the needleless connector using a push and clockwise twisting motion until secured together. Open the clamp on your IV catheter and/or IV extension set if indicated. Flush your IV catheter using a push-pause method. Do not attempt to flush if resistance is met. Double check that all clamps are open, then call your nurse or pharmacist. Lastly, remove and discard the saline flush syringe in a trash container. You are now prepared to administer your medication. Scrub the needleless connector on your IV catheter with an alcohol wipe for at least 15 seconds and allow to air dry. Remove the protective cap from the IV tubing. Attach the IV tubing firmly to the needleless connector on your IV catheter. Open all clamps on the IV tubing. Start pump will appear on the screen. Select Yes. The message in the status bar will change to a green running message. An infusion starting now appears briefly. You will know the pump is running when the green light is blinking. The infusion can be paused by pressing the stop-start key. To resume your infusion where you left off, press the stop-start key again. Your pump will alarm if you do not restart within a few minutes. When it is time to change the bag or you've been instructed to stop your infusion, stop the pump by pressing the stop-start key. When the screen reads Stop Pump, select Yes. Disconnect the IV tubing and discard all supplies as directed in a trash container. You are now ready to flush your IV line with saline again. Scrub the needleless connector on your IV catheter with an alcohol wipe for at least 15 seconds and allow to air dry. Remove the protective cap from the saline flush syringe. Attach the saline flush syringe to the needleless connector on your IV catheter. Flush your IV catheter using a push-pause method. Close the clamp on your IV catheter and/or extension set unless you have been instructed to flush with heparin. Lastly, remove and discard the saline flush syringe in a trash container. This will conclude your IV medication administration unless heparin has been ordered. If ordered, you will need to flush your IV line with heparin. Scrub the needleless connector on your IV catheter with an alcohol wipe for at least 15 seconds and allow to air dry. Remove the protective cap from the heparin flush syringe. Attach the heparin flush syringe to the needleless connector on your IV catheter. Flush your IV catheter using a push-pause method. Close the clamp on your IV catheter and/or extension set if indicated. Lastly, remove and discard the heparin flush syringe in a trash container, thus concluding your IV medication administration. Here is a SASH procedure summary to ensure you are administering your IV medication effectively. Flush your IV with saline. Administer your medication as instructed by your nurse. Flush again with saline. Flush with heparin if prescribed. With each administration of IV medication, you will get more comfortable with the supplies and the steps. For any questions or concerns you might have, please contact our highly trained specialty nurses who will help you understand the basics of home infusion therapy and will answer any questions.